Hey, welcome to Resilience Radio. I'm Irvin Eisenberg, host of the show and owner of Resilience Occupational Therapy. This episode is a panel with 3 different healthcare practitioners, and as always, their opinions do not necessarily reflect mine or that of Resilience Occupational Therapy or Resilience Radio. Additionally, none of it's meant to be medically diagnostic or prescriptive in any way. Everyone has their own unique health, and you should seek your own healthcare practitioner before making any health decisions. I wanted to apologize in this episode. The sound quality on my mic is particularly bad. I think you're able to hear it, but it's not the quality that I like to showcase. Additionally, I had a couple of issues with the edit, so there might be times where the guests seem to not be entirely aware of each other, or not exactly interrupting, but not responding as smoothly. And I assure you that they were a sociable bunch that were interacting well, and it wasn't any choppiness is me, the editor's fault, not that of any of the practitioners. In any case, I think this is a good episode, despite my technical difficulties, and it's the first of 3 episodes with these practitioners, and the other ones are edited better. So check this one out, and then you can check the other ones out later. Enjoy.
It's great to have the 3 of you on here. We've got Josh Singer, an acupuncturist, Betzy Bancroft, a clinical herbalist, and Melanie Myers, a naturopathic doctor. Thank you 3 for coming on. So I thought we would start off with talking about digestion. And people have common issues with constipation, diarrhea, and nausea. These things come up all the time. And I know that there's each of you probably has your own way of trying to get to underlying problems and assessing that. But I wanted to just, hear your general takes on digestive health. And we can start with Betzy.
Okay, I do appreciate the digestive system. And so diarrhea and constipation, there's a few roots to those. One is overall motility. And motility is connected in with our emotions. It's connected in with what we've eaten. It's connected in with a lot of things. And so I like to look at some of the key dietary and herb strategies that help balance out motility. And one of those is demulcents, which is soluble fiber, basically. And I know Melanie will talk about fiber, the importance of it too, at least. But yeah, like keeping things regular. And then there's a lot of herbs, particularly the ones that combine the actions of carminative and nervine, which are herbs that usually carminatives are aromatic and work on the gut lining itself. And then nervines address the nervous system. So they are also really helpful for balancing out motility. But yeah, so soluble fiber in the diet balances that out, like slows it down and normalizes. If it slows it down, if it's going too fast, and speeds it up or softens it up if it's going too slow. And then I like carminative nervines, which are often very nice in tea. Herbs like mint and lemon balm and things like that. Easy, delicious, and bitters. Oh, well, everything like bitters stimulate stomach function. So again, helping to promote good digestion, which also promotes good motility. So everything from dandelion root to more bitter things like artichoke leaf, usually taken as a tincture before meals because they're not as much fun to drink as those carminative teas. So that's kind of my general approach to motility. And therefore, like preventing either getting to the place of diarrhea or preventing getting to the place of constipation. But then, of course, there's things to do for them when they do show up. But
yeah, did you want to take it from there, Melanie?
The first question I typically ask people when we're talking about motility, like Betzy, I think motility is really, really crucial to understand when you're working with somebody. The important thing here is a lot of people have very different ideas of what constipation is. So one person that comes in and tells you I'm constipated, the motility for them might be quite different from another. Example, for some people, a daily bowel movement is considered, in my case, I think my optimum goal for most of the people that I work with is making sure that everybody's having a daily formed stool, easy to pass bowel movement. That feels like an optimal digestive strategy. And there's some wiggle room on either side of that, but naturopaths tend to like the daily. But for many people, constipation might look like I go daily, but I have to strain and push, and I have small pellet-like stools. That might be one person's definition of constipation. Another person's definition of constipation might be I have big voluminous bowel movements, but I only go every 5 days, which certainly is a quite different reality. So when we're sort of defining motility, you have to really get into the nitty-gritty details with somebody about what their patterns actually look like, because we're going to support them differently depending on what we see. If we see a dry daily but dry and painful pattern, we're going to treat them a little bit differently than somebody who has voluminous bowel movements but is maybe only going every 4 or 5 days.
Okay. And Josh, you have you come at this from a different perspective, I'm sure, with the Chinese medicine. What do you have to add to the overall digestive conversation?
Yeah, I appreciate really looking at the individual person's experience because, I agree with Melanie and Betzy as well. There's people often use the word constipation or diarrhea or something like insomnia or something. It doesn't. You really have to ask them exactly what their experience is for us as practitioners to really help guide and choose the right direction. And Chinese medical thinking, we're always looking at this individual, looking for where is the imbalance in this person. Whatever symptoms they're presenting is like secondary. First, we find out, or is a clue, is it surely a clue? But the first is finding where is imbalance. And people who have digestive disorders or symptoms have some typical imbalances that we're kind of looking for. For example, in Chinese medical thinking, the spleen and the stomach are actually the organ that consider the yin-yang organs that help promote healthy intake and distribution of food, just in general. We're talking somewhat about elimination here, but digestion in general, we think of the spleen and the stomach actually. Of course, the spleen in Western medical thinking is not necessarily related to the digestive process, but in Chinese medicine, it is considered, along with the stomach, the digestive organ systems. So we're looking to find out how is the health of the spleen, how is the health of the stomach, and depending on what the stool is like, what bowel movements are like, that surely gives us a clue. Some people don't have strength to push. And sometimes that's an elderly person who's having constipation. Sometimes it's coming from weakness of the body. So there's weakness that may create this motility issue. And then there can be excess in Chinese medical thinking, like what we call as heat. Like imagine stool sitting in the intestine for an extended amount of time and water getting absorbed through the intestinal wall and becoming dry and hard. In Chinese medicine, that's considered a form of heat, like stagnation and potential heat. So heat creates dryness. This sort of thinking is more of an excess type of condition, typically, not always, but just to give you some ideas of my thought process when somebody comes in. We investigate whether they're having nausea as well, or, investigate the whole digestive process, including the elimination part of that process, if they get pain in the upper intestine, if they get cramping in the lower intestine, this all gives us clues. For me, in Chinese medical thinking, the pulse really is a guide for me, really above anything. Even if the person didn't talk about any symptoms, I would still feel their pulse, and that would be a guide for me as to diagnosing. I mean the sensation in the vessels on each side of the wrist. And typically we'll feel in the particular position, we'll feel some weakness or some excessive sensations which will guide me. And then, so there's the diagnostic process of the individual. And then, there's the treatment process of choosing particular acupuncture points to regulate the intestinal function. Like there's a couple on either side of the navel that are really commonly used that we know can regulate the function of the intestine, whether that's excessive or meaning whether there's moving too fast or moving too slow. We can actually regulate that. There's a couple points on the lower back as well that we commonly use. They're on the lower leg. So there's various acupuncture points we've learned can help regulate the intestinal function, as well as the digestive function in general. There's one in the very middle of the belly we use often. And then I will often use herbs as well. And I find in my practice that Chinese herbal formulas sometimes are more important with digestive issues than acupuncture. That's just my clinical experience, because we're intaking these herbs and they're being digested themselves. And sometimes, when we're treating an asthmatic condition, herbs can be effective as well, but particularly with digestive symptoms, like you others as well probably see this. We can improve. Chinese rhubarb is a familiar, commonly used Chinese herb that really will get the bowels moving. Like almost every time I've used it, we have to be careful and not use too much, but to really soften and moisten the intestines. Chinese rhubarb. We use apricot seed is another common herb we use that moistens in Chinese medical thinking. So there's some common formulas that include some standard herbs that can help regulate intestinal function.
Yeah, and I was wondering about what you guys have. There's been talk of sort of what norms are or what's abnormal. I'm curious. I feel like people's digestion can be so far off that I'm curious if anyone wants to speak to what they think normal digestion should look like.
I can speak to mine, and I kind of alluded to it a little bit, but I think that, and I wouldn't say normal because normal is kind of a weird, it's a weird word, right? But I would say optimal for me feels like daily. And it's Bristol 4, which there's the stool chart. That's 1 to 7, and 4 is a log. Not to be crude, but this is an easy way to describe it. It's a log. It's not too hard, not too soft, easy to pass, no pain, comfortable. Person feels like they have fully evacuated. To me, that's an optimal circumstance.
Yes. I'm also looking for someone to feel good after their meal as well. I'm also checking into their upper digestive function, which relates to their lower. But yeah, people shouldn't feel heavy or gurgly or have any, discomforts after they eat either, if their food is processing. And that stomach function particularly is cooking and ripening the food in a good way.
I might have this wrong, and Josh, please correct me if my Chinese lingo is incorrect about this, but this is making me think about the triple burner in Chinese medicine, which is like one of those harder to define organs where there's the upper burner, the middle, and the lower. And I didn't know if I was sort of on the right track with that, Josh, and if so, if you could speak more to that or whatever else you'd like to.
Yeah, I think you stated it. Good introduction around the triple burner. It is one of these sort of, like not so defined organ in Chinese medicine, but it refers to different areas of the body. In general, the upper burner, we think of the lungs and the heart and the chest, and the middle burner, more of the liver, gallbladder, stomach, spleen, and then the lower burner, more of the lower organs, intestines, bladder, kidney. So with this smooth process of digestion, you're going from the upper burner to the lower burner, and there should be a smooth process. If there isn't, we get these symptoms we're talking about: fullness in the epigastric, in your stomach area, or some dysfunction with not matching that optimal stool is a sign that is not the motility or the movement is not happening smoothly throughout those triple burners, like you're saying, Irvin. So it's another way to sort of look at it. smooth movement through the triple burner, or we call sanjiao in Chinese, or triple heater is another way. And there's certain points. There's a channel that we relate to the triple burner channel. There's a very specific pathway that is in the upper part of the body that we can stimulate certain points to regulate. There's one particularly on the triple burner channel that is indicated for constipation. It's a commonly used point. So it's interesting you pointed out, Irvin, without being an acupuncturist, knowing about the triple burner, there's a really common point. It's on the top of the wrist about here. Oh, people can't see that who are listening to it. I do that every time.
What is the name of that point?
We call that Waiguan. The outside, it's just above Waiguan. The actual name of that point is escaping my mind, but we have that one on the inner wrist, we call it Neiguan, inner gate, and then there's Waiguan on the outside. It's just an inch above it. I can't quite think of the name at the moment.
I think part of me wanted to come back to something that Betzy had said too, because I think it can't be underscored enough, is the role that the emotions play in our motility and our digestive well-being in general. We know, and it's only been in recent years, as medicine would have it, that they've really identified and started talking about the enteric nervous system. So we have this unique neural network in the gut that does a lot of local regulation outside of our central nervous system, meaning mostly brain, spinal cord there. We have this unique network of neural functioning that's happening without our conscious awareness. Our emotions drive a lot of our bowel patterns, and often our emotions are, we have set personality types and tendencies, and so some folks do tend towards, when people come into my office, I'll say, do you have any tendency towards either constipation or diarrhea? Because in many cases, for example, somebody who tends towards constipation, they'll usually quite vehemently tell you, oh, I'm always constipated, or I always, kind of default to constipation. And there's a certain emotional pattern that can perpetuate that for folks. So we always want to look at that, and Betzy kind of nailed it on the idea for me about making sure that you're addressing the nervous system. When you're considering this, you can't leave that out of a protocol for constipation or any digestive malady for that matter.
I'm reminded of a story when I was in massage school from a shiatsu instructor. So that's Chinese medicine, but via Japan. And the instructor was talking about a friend of theirs who was really constipated and was saying, hey, can you come help me out with pushing some of these points and such? And they said, yeah, I'll help you out, but first thing we have to do is clean out your closet. And they literally went over to the friend's house and helped her get rid of all this clothing that she had been hoarding. And I think there was some loved one involved, and there was some mourning and grief stuff going on, like getting rid of her loved one's clothes. And as soon as they started getting rid of that, the person ran to the bathroom, and the problem was solved by the closet, not by any herbs and such.
By addressing the metal element.
Yeah, that's right.
Another, picking up on what Melanie said too, and yeah, metal element, that's the large intestine system, that's part of it too, but stress is a factor, because we've heard of serotonin. Most of the serotonin in our bodies is made in endocrine cells that live in our intestines. So it's also plays multiple roles here, because it's a chemical signal molecule for motility, but obviously it also has a lot to do with stress response and how we feel and all the things too. So yeah, guts are connected.
So I'm sure we could discuss digestion for hours, but in the interest of, if anyone had any sort of closing thoughts or questions that they wanted to present regarding digestion at this point.
Betzy started it, but we forgot to talk about fiber. The thing that I usually tell most people, and this is not just for constipation, but for general health is, I think most people, and that's not just an I think, there's some good data behind this. Most people do best if you can get them up to 35 grams of food fiber per day. And the first time you figure that out, most of us aren't necessarily tracking our foods all day, but there are some great fiber charts that you can scope out on the internet just to get an idea of per serving how much fiber a food has. And as Betzy mentioned, there are both soluble fibers and then insoluble fibers. And the insoluble fibers are the parts of plants that we don't digest personally. So what that adds to our situation is bulk, and bulk ends up providing a little bit of counter pressure to our intestinal walls and encourages motility. So the closer we can get to that 35 grams, I generally think the better health we realize. You see other benefits from that too. It helps with cholesterol management and balance, and that motility factor is a big one with fiber. It also ensures that you're getting a lot of vegetable content foods by making sure that you have that much fiber in your diet every day.
Well, thank you guys for discussing that. I really appreciate the insights on that.
I hope you enjoyed this episode. Thank you for listening. Again, I apologize for any of the clunky technical difficulties in this that just made things a little more choppy. The music is brought to you by Aaron Marcus with their tune Some Biological Process. You can check the show notes for full credits on that. If you enjoyed this episode, you can check out the next 2 episodes. So next week and the following week, we'll be showcasing more episodes with Melanie Meyer, Josh Singer, and Betzy Bancroft. And I hope you enjoyed. Until next time, take care.